Welcome to Doing Divorce Different. Listeners, I am so thrilled. I must tell you, my guest today doesn't know this, but actually was kind of an answer to my prayers, which is interesting. So I have Dr. Adam Woods with me, and he's a family psychiatrist. We can talk more about that later. But what what got me connected to Dr. Adam is I have someone I'm really close to who was looking for some help and happened to just find you. I don't even know, like online, went to you, met with you, and it has changed this person's life. And this person rattled off the 5 steps to well-being, and it is so in line with me and my life and what I want from my clients and my listeners that I just feel like I can't tell you. It's a privilege to have you here. So I was so excited that you were going to be on the podcast, and then I asked for your bio, and I'm like, oh my gosh, we could talk about your life, Dr. Adam. I mean, we could talk about that probably for a full episode. We don't know if this is going to be 1 or 2 episodes. It depends on how long it is. But we're going to start out where I want to get to know Dr. Adam a little bit better because he has a really interesting story, a unique story about how he landed in doing what he's doing. Then we're going to talk about the 5 steps, the process to well being. And then, if we have time in this episode or for the one following, we're going to talk specifically about maybe some divorce tips that Dr. Adam can share with us. So, welcome, Dr. Adam.
Well, thank you so much for having me. That's quite an intro. I hope I can live up to it.
I think Joe Rogan's going to be calling you after he hears all the interesting things in your life. Honest to God.
That'd be great. Sam Harris, too. I'm a big fan of Sam Harris.
Oh, yeah.
So there you go.
All right. Well, I'm thankful that you're here. And what was so interesting to me is I'm looking, for one thing, anytime anyone's a medical doctor, I want to fall down and thank you. My daughter is one. And what you go through to become a doctor is so grueling and takes such dedication that now when I see, I mean, it was always service people and now it's service people and doctors, I'm always thanking that they put the time in. So that's a huge deal. But you didn't go there right away. Can you just share your story and your journey with the listeners?
Yeah, so not to bore people to death, I'll try to get to it, and I'm not good at doing that. But I was born in a small Iowa town with only about 4,000 people, but we moved to the big city of Des Moines, the capital, when I was about 10. And I was a very awkward child. I had a fairly pronounced stammer. And if you get me in a position where I'm nervous, I'll still stammer quite a bit. But I got involved in singing, which was sort of a big thing for me. And that kind of led me to opportunities where I was doing theater. And my mother recognized my my passion for that. And I was raised by a single mother who I think was, kind of looking for outlets for her son where sports weren't a big thing for her and what were ways we could connect with things. So I started going to see whether it was the touring productions at the Civic Center in Des Moines or the local community theater, and I just fell in love with theater. So after high school, I actually thought about being a doctor in high school. You mentioned the grueling thing that we go through. I thought about being a doctor in high school, but thought that I was too dumb because all of the doctors I'd ever met, especially in that small town, they were treated like gods. And I thought you had to be a genius to be a doctor. That'll come back in my story. But I decided to go to nearby Drake University and to major in theater. And I majored in acting and playwriting. And I got to spend a semester with the National Theater Conservatory in Connecticut. We spent time studying with the Royal Shakespeare Company in England. And then after that semester, I actually went to New York that summer and wound up getting a bunch of professional jobs. And I spent nearly a year on a cruise ship as lead singer and was all over the world. This is before 9/11. I was 21. I turned 22 on the cruise ship. Wow. So a wonderful time for a young man in his formative years to experience all these different languages and religions. And I always say to people, I could lie and say I was looking to meet people. I was looking to meet girls, but in the different countries where there were girls my age, there were guys my age. And so I made friends all over the planet.
Right.
And I didn't know that, as an example, I mentioned 9/11, that America was hated. Like, I didn't know that because I've been sheltered and so forth. But it really opened my eyes to different philosophies and so forth. So I got a few more acting jobs and decided I was actually on tour in Texas when I realized that, you know, theater was probably not going to be my vocation. It was my passion. It was my avocation, but I wasn't going to do it sort of full time. And I had really set out to do what I wanted to do, which honestly was prove to my parents I could be a professional actor and pay the bills. And so I had done that. And so I started thinking about what are other careers that might sort of play to my strengths. And when I was on tour in Texas, we were in a different town every single week. And back then I was fairly involved in the Presbyterian Church, which is the church where I was raised. And almost none of these churches had pastors. And I started thinking about it, and I thought, you know, what are the skills it takes to be a good parish pastor? You have to be able to speak in front of people, sing in front of people, walk into a room where you don't know anyone, like someone's home or a hospital room, and talk to people. And I thought, these are all the things that I'm good at doing. And so I got a full ride to Princeton, which was founded by the Presbyterians long ago. And so I thought, this is the next move. So I finished my undergraduate degree and I went off to Princeton. And I actually got to be involved in theater a lot when I was in Princeton, both the university theater, and then New York is a short train ride away. And so that was great. But I started doing my basic seminary studies from what's called a Master's of Divinity. That's the basic degree that most ministers have. And I joined the Air Force my first year of seminary because my grandfather, who was more like my dad, because my dad had left when I was really young. We could talk about that. My experience with
I know, that's
as
interesting.
a child, right?
Yep.
But so my grandfather had been in World War II, and so the Air Force and actually all the military services have this really cool program. At least they used to, where if you want to be a chaplain, you can go and train, and they'll pay you, and you do all this stuff. But you're not required to sign a contract that will then commit you to 4 years or 6 years or something like that. So I went off and did this Air Force chaplain training, and I loved it. I thought it was fantastic. And the first summer, I wound up at the base in Omaha, which is, you know, close to my family,
Yeah.
and I made a lot of very powerful friends. And that's important because it plays into the next part of my life. If you ever watch the movie A Few Good Men, Jack Nicholson says at one point to Tom Cruise, I don't want money, I don't want medals. And so that's actually really true in the Air Force and in any military service. What you want are favors. You want somebody with a lot of power owing you a favor. The best would be the president, and the second would be the vice president, and so forth. Well, I had a 4-star general owed me a favor because once I got to that base, I was playing the piano and singing and doing all this stuff. And it was actually his wife that befriended me and had me play the piano and sing when they would entertain senators and congressmen. And Omaha is a very powerful base. For those of you who don't know, that's where Bush was taken on 9/11. So anyway, I had these very powerful friends. So my second year after seminary, which is 3 years, I asked to go into a hospital chaplain training program. I didn't really think I was going to be a hospital chaplain. It was very prestigious. And because I had these really powerful friends, I got in right away. Whereas people had to, you know, sort of, I mean, I was a good candidate anyway, to be honest.
Right.
But I got this thing. So I got sent off to the Seattle area. And for those of you that don't know this, in 1947, the Air Force came out of the Army. So if you ever hear someone in World War II say they were in the Air Force, they were in the Army Air Corps. And then the Air Force broke off in 1947. So the Army still does a lot of stuff with the Air Force. We train with them and really work with them a lot. So anyway, I got sent to this Army base in Tacoma, Washington, Madigan Army Medical Center at Fort Lewis. And I found myself working in this hospital. And because I was living on the West Coast, my girlfriend at the time was in Baltimore, and I didn't have much else to do. Plus, I'm kind of a workaholic. I would volunteer for extra duty in the hospital. And I was in the ER and the post-surgical units, and I just loved it. I loved working in medicine. What I noticed very quickly was the really good doctors were doing my job. They were sitting with the families, being present, being very spiritual, but not proselytizing, being comforting. And then the very bad doctors would just come in the room and just wreck the place. And I remember, and so I would be in charge of cleaning up after those people. And I won't tell my favorite story, but there was a story in the ER that was just awful of what I saw the physician do. And so I was walking all around the hospital, and people would ask me about their diagnoses. They'd say, "Oh, Lieutenant, what do you think about this? The doctor said this about the cancer or the whatever with the heart disease." I didn't know anything. I had never gone to that kind of school. And so and also when you're a chaplain and people come to the ER seeing angels or hearing the voice of God or something like that, they tend to call you. And so I knew all these psychiatry residents. I didn't know what a resident was. I just knew they were doctors, but I had all their phone numbers on my cell phone. And a lot of times I have to call them and go, "I think this is one of yours and not one of mine." And so I was raised by mental health care workers, not doctors. My parents actually don't like psychiatrists. It's kind of funny. But, I went back to Princeton and I finished my senior year with the idea that I would just go and be a pastor or a chaplain or something like that. And I just couldn't shake the feeling that I wanted to be a doctor and that I really wanted to pursue medicine. I was so inspired. And that particular base, we're talking about the early 2000s. So Fort Lewis, Washington is a big Ranger base, 3 big Ranger battalions there, and they took heavy losses during shock and awe. In fact, the first chaplain killed since the Civil War was killed at that base, and I happened to be there. So it was a very interesting time because unlike Vietnam veterans who got, "We hate the war and we hate you, you're baby killers," and so forth, we, the veterans of the Operation Iraqi Freedom, we hate this war, but we love you and thank you for what you're doing. So I felt very supported and so forth. But remember, I thought doctors were geniuses, and I thought you had to be really, really smart to go to med school. And then I met all these residents working at that Army hospital, and I realized that they weren't geniuses. They were smart, but what they were was hard workers. I'm a hard worker. So in seminary, I had to take Greek and Hebrew and Latin, and study hard is something I know how to do. All right. So I started talking to some other people that I knew, some doctors, my girlfriend at the time who was getting her PhD at Johns Hopkins, and she knew a bunch of doctors. And I thought I was 26 and I thought I was too old. It's the folly of youth, right? And I really expected everybody in my life to say, "You're insane. You're too old. You've just got your master's degree. Why in the world would you want to do that?" And almost everybody in my life was like, "That's a great idea. You should totally do that. What a fantastic idea." So I had to go back to undergrad and do some post-baccalaureate work. And I take chemistry 1, biology 1, physics 1. In fact, I did the math. The first day I was sitting back at Drake, my undergraduate school, taking chemistry 1, I did the math. The day I was a real freshman, the rest of those kids around me were starting 5th grade. So that's how old I felt. But, I studied my butt off, and I got a really, really good MCAT score and was the first student ever in the history of Drake to get accepted to Duke, which was my top choice for medical school. And off I went to Duke, and I did 4 years at Duke, and had to admit to myself, I swore I wouldn't be a psychiatrist. I swore I wouldn't be a psychiatrist because my parents thought I'd be a psychiatrist, and that girlfriend's dad, who was a doctor, swore I'd be a psychiatrist. And my first rotation was psychiatry, and I loved it.
Yeah.
I thought, "Oh man, I love this." And then, when I did my pediatrics rotation, I loved that too. And I thought, "Oh, good. I'll be a pediatrician. That way I don't have to be a psychiatrist." And so I did a pediatric psychiatry rotation. That was it. I never looked back. So I came back to Iowa 10 years ago. This last June, I moved to the Iowa City area, fully intending on going back to North Carolina once I got my residency done. And wouldn't you know it, I met a girl and we got married and had a baby. And now, like many generations of Woodses before me, I'll probably die in this state. And I'm okay with that. And I will say, just to bring it back to your listeners, during the time I was in med school, I actually was married and got divorced. So that
I didn't know that. Oh.
That very much will inform the second part of the conversation that we have in terms of my own experience. So not only a child of divorce, I myself am divorced. My current wife was divorced once as well. So it actually was one of the conversations that bonded us in the beginning. Mm-hmm. We'd both kind of been down this path. But anyway, so I now live in the Iowa City, Iowa area. It's one of those places where you've got 3 or 4 little towns that are really close together. So technically I live in Coralville. My office is in North Liberty, but nobody knows where those are. Iowa City is where the University of Iowa is. Yeah. And so I've been here for 10 years. And honestly, I don't think I'll ever leave. I love the Iowa City, Iowa area. I'm close enough to Des Moines. My mother is still there, and she can come and see her granddaughter and all that. But I like this town. It's fantastic. So that's the I told you it wouldn't be short. That's my circuitous story that got me here.
It's so, so good. And I'm so thankful that you followed your passion, because look at the impact you're having on people's lives. I mean, I told you about one. There's many more. So what a great story. Thank you so much for sharing that. That's a good one. It wasn't that long.
No, no, it
And I
wasn't.
have to say, I love that city too. I am just getting to know it because my daughter is doing her residency there. So, yeah, Iowa is fantastic.
There's a lot to recommend it, and especially in Des Moines and Iowa City. And then
Mhm.
my wife is from this very odd little town in southeast Iowa, but it's also so I would say a cultural gem, sort of buried. And Iowa's got several of those. When I was traveling on the cruise ship all over the world, every time we'd be in a city for more than a day, I tried to wear one of my Iowa or Iowa State or Hawkeye type shirts, and I would get stopped
Yep.
in Egypt, in Istanbul, in Russia. Yeah, wearing that tiger hawk, which is the crest of the Hawkeye.
Yeah.
Somebody inevitably would stop me. Copenhagen, Paris, and they go, "Oh, you from Iowa?" And so it's funny. It's a little state, but it seems to have an impact on people. So there you
Yeah,
go.
it
I
does.
hope your daughter is enjoying it.
Yeah, the hospital is amazing. She's in pediatrics.
Oh,
So,
great.
yeah, yeah. So similar to you a little bit. But okay, so now that we know your story, and a little bit more about you, and we trust you, and you've done amazing things, can you share with the listeners those 5 steps? And
Yep.
I think, if I remember correctly, and I'm taking notes, there was an order to them.
Mhm.
There was one that you felt was more important. And the reason this is so important to me and my listeners is I want everyone to be healthy no matter what. I want my family, I want my friends, but I want my clients to be too. And
Right.
when you are going through a divorce, it is a really hard time. And my number one thing is take care of this, take care of
Yes.
your well being. And so, any information like this that I can share to help them is going to just get them headed down the right path.
Right. Great. And that's a great message. It's really important. So I'll just sort of tell you my little spiel that I would normally work on with a patient in a situation like I told you before we started recording. I've listened to 3 of your previous episodes. I'll tell you kind of what I would say, and I'm going to piggyback quickly off of what you said, which is I tell people when they're in the process of divorce or they've lost a job or a loved one has died, it's very much the same kind of loss. And if you look at the psychological literature, it's identical. So most of us are familiar with Elizabeth Kubler-Ross's work, and if you're not, you know what she said. That's the denial, bargaining, and all of that. What's funny though is that as we're going through that, we need to be really patient with ourselves. But one of the things is we forget in the midst of crisis to do normal things to take care of ourselves. And here's the problem: our body can't talk to us. So all it can do is make us feel bad. All right. And then what it hopes happens, I know I'm anthropomorphizing our body, but this is evolution, right? So when our body makes us feel bad, it hopes we'll pay attention. And so what'll happen is people come to me and they've had this big loss and they're feeling depressed or anxious or a combo of the things, and they're not sleeping well, they're not exercising, they're not eating well, they're not showering, they're not shaving, they're not doing anything fun. And they go, "Well, I feel terrible." And I go, "Well, when was the last time you ate a vegetable?" "Well, it's been a week or two." Okay, so drink a glass of water, eat a vegetable, go for a walk outdoors every now and then. Like, we get so focused on the minutia, and what happens is our body goes, wait, our routine is thrown off, and it makes us feel bad. And we assume that I feel bad because I'm getting divorced, my mom died, my whatever happened. And so then we just keep driving forward, and we don't, and then our body goes, "Well, he didn't do what I wanted him to do. So I'm make him feel worse and see if he can't. Well, now I need more medicine, or now I so forth." So
Right.
self-care is important. All right. So here gets into what I call the 5 things that you referenced. So when I was in my first year of residency, I was very disheartened as a physician because I was following the textbook, like start this medicine, go up in dose, add this medicine, do this. None of my patients were getting better. And that's disheartening for me as a scientist because I'm used to, if you follow this, like in chemistry, add this to this and this is going to happen. It wasn't working. Nobody was getting any better. And then I broadened my scope and realized none of my colleagues' patients were getting better either. Not just the residents, the attendings, the senior doctors. No one was getting any better. And I thought to myself, wait, I've been taught this medical model of psychiatry that they're still teaching, probably literally right this minute over at the hospital. They're teaching the medical students, oh, it's a chemical imbalance in your brain, and you
Mhm.
just need the drugs, and it's all going to be fine. I'm here to tell you that's actually been disproven in numerous studies, and there's literature all about it. And so, but that's not what we're taught. We're taught this biological model: take this pill, and everything will be okay. So I decided, okay, I'm going to start looking at the research myself and figure out what is actually efficacious for treating people that are having, whether it be a definable mental illness or something like what your clients are going through, this sense of
Mhm.
loss, call it depression, call it burnout, call it whatever you want. And it turns out there's really, really good literature out there. And it turns out there are 5 things that have consistently been shown in every study to be better than medicine. Okay. And so that's where I began to focus my studies. So if you look at my resume on our website, I went back to school and I got certified in nutrition, I got certified in exercise stuff, and I can't call myself a sleep expert because that requires a fellowship. I did lots of work with the sleep people when I was still at the university, and all kinds of other things. And I realized that I needed to teach my patients better what are these things we can do. Now, for anybody listening who's on psychiatric medicine, I'm not saying don't be on psychiatric medicine. Okay, and definitely don't stop it without talking to your physician. Okay, just right away.
Mhm.
But we're taught if I just find the right drug, everything's going to be okay. Now, in 10 years of practice, and if you'll give me my last 2 years of medical school, 12 years of practice, I've seen that happen. Find the right pill, everybody feels better. But it's much, much more the exception than the rule. Okay, so if you look at the actual research, and this is what I do for patients, this is the pie graph of how do I treat you, okay? This
Mhm.
little sliver right here is about 5%. It's actually about 2%, but I'm going to give it 5%, like the bigger upper bound. That's medicine. So on its best day, medicine is going to be 5% of the treatment for most things. There's obviously exceptions to that, all right? But then what's the other 95? Because that's way more efficacious. Imagine picking up a 25-pound barbell with one 5% of your finger, right? I mean, you might be able to move it a little bit. You're not going to be able to pick that sucker up. So what's the 95%? How can I use the rest of my hand? That's the 5 things.
Yep.
All right. So here's the metaphor I use with patients just to get everybody filled in. Imagine if you came to me with a broken arm and I went, here's a pain pill. You'll never feel that arm again. That's terrible advice, right?
Right.
I should lose my license. Now, at the same time, you'll meet people, it's usually therapists, who will say, psychiatric medicine is garbage. We should just throw it all away. No. That's baby with the bathwater. Back to the 5%. So you come to me with a broken arm, and I say, okay, the real treatment for a broken arm is casting, maybe surgery, physical therapy. Now, while we're doing that, I am going to give you some pain medicine to help you get through it to control symptoms. But the
Yep.
pill doesn't make the arm better, does it? It helps you get through the real treatment. That's psychiatric medicine. So this is why I say don't just sort of give up on the idea that medicine may help in the short term. What you really want to do is what I call the 5 things. Okay, and so here are the 5 things. We're going to go
Okay.
through them one at a time. All right. So number 1, the king, the queen, the undisputed heavyweight champion of the world is therapy. Okay, so talk therapy beats medicine in every study ever done, not paid for by a drug company. All right. Therapy is absolutely for every single psychiatric disorder except pure ADHD with nothing else going on. And actually in kids that are younger than about 10, it's the best treatment for that too. But we're talking about adults here because 10-year-olds don't tend to get divorced. All right. So so anyway, so therapy. And so people will often say to me, "Oh, I tried therapy. It doesn't work for me." I'm here to tell you with all the compassion in my heart, saying that therapy doesn't work is like saying food doesn't make me full. Okay, we didn't do the right kind and the right amount. And the number one predictor of how well do I do in therapy is rapport with the therapist. So, how well do we get along? So, even if you've tried 3 people, you haven't found the right person. All right. And
Mhm.
I see with our timing, I'm so sorry. Um,
Just keep going. This is so good.
I
Yeah.
want to give you my full spiel. I tell patients this. So when I got out of the military and I went to medical school, I was having a little bit of trouble getting back into civilian life. Now I didn't have PTSD, but there's some things in civilian life after that many years that I just kind of was feeling weird about. So I went to the counseling center at Duke, and they kept putting me with these therapists that were graduate students. They were younger than me. They had no life experience. They'd gone from kindergarten into graduate school, and they had nothing to tell me. And so I kept firing therapists and going, listen, this isn't going to work. And they eventually stuck me with the guy that ran the clinic. He was older than me. He had been divorced once. And frankly, he kicked my butt a little bit. There's a military expression. He put me against the wall, which means he kind of lined me up and said, hey, pay attention to this, whatever else. But he was like lock and key. It took us about 2 sessions and I was done. And it was so good for me as a young medical student, because I thought kind of once you're in therapy forever, because you hear about Hollywood starlets like, I've been in therapy every day for 20 years. Well, it doesn't have to be forever and ever and ever.
Okay.
If you can find the right fit, it's going to go like peanut butter over bread. I mean, it's fantastic. All right. So therapy is absolutely the key. And I tell people, keep looking for the right person. And it's the one time in life I would ask you not to be PC in your own mind. So when it comes to who do I want to be a therapist, if you rather have a man over a woman or a black person over a white person or a Jewish person over, fine. Now, the more parameters you put on it, the harder it's going to be to find that person. You may have to go to Chicago or New York, or, but now with telehealth, we actually can do a lot of that. So pre-COVID, that was unheard of, but now you can really find that lock and key. But keep going, because that's going to be the best. And then therapy is not a passive thing. This is what everybody thinks. So for those of you that are my age or or older, you're going to remember the movie Good Will Hunting. All right. So and in comes Matt Damon. He sits down and he goes, "Let the healing begin." All right. So that's exactly what people think, that therapy is some passive thing where you sit there and the therapist imparts something upon you. That's not what modern therapy is about. Modern therapy, CBT, DBT, ACT, they're all about what is happening and what do we do about it. So it's going to be, here is your homework, here is what you need to do, and you have to practice. Okay, just like if you were going to play an instrument or learn to do anything else, you need to work with the therapist and really work on it. But I promise you, that is absolutely number one. And even if it's not for very many sessions, fine. So number one of the 5 things, no question, hands down, therapy. Okay. All right. Number 2 is sleep. Okay. So sleep is highly underrated in Western medicine. Eastern medicine has known this forever. Okay. But highly underrated in Western medicine for how powerful it is. Okay. When people aren't sleeping well, I will say to them, if I could change nothing else about your picture except making you sleep better, you would get better. Now, how much better, I can't say, but I promise you, you will get better. This whole like 4 or 5 hours thing, I don't think I need it and whatever else. Look at what else is going on in your life, okay? And so the number one problem with sleep in the modern world is technology, okay? So the American Academy of Pediatrics, and it works for big kids too, recommends no screens at least an hour before bed, no screens in the bedroom, which I know is like, heresy, but if you're sleeping fine, then I don't care what you do. But all that light, even if you wear blue tinted glasses and all that interesting stuff on there, that's the number one cause of insomnia. So 2 books I want to highly recommend to any listeners. The best book ever written about sleep in the history of the world, all right, is called Quiet Your Mind and Get to Sleep by a woman named Colleen Carney, who I don't know, so I don't make any money if you buy her book, okay? It's just amazing. That is the best how-to guide for sleep you will ever find, okay? The second book is called Why We Sleep by a UC Berkeley professor named Matt Walker. Now, Matt Walker has done the rounds. He was on Rogan. He was on Sam Harris. His book will sell you on why sleep is good. So it's not that much a how-to. It's a why sleep is important. And most books that talk about research make you want to whack your head against the wall. They're so boring. His book is awesome, and I love Audible. I am like totally addicted to Audible. His Audible book, and for those of you listening and not watching me, I'm doing air quotes. I could not put it down. Okay, it was so amazing. So Walker's book just was life transforming for me. I'm not kidding you when I say, if I could go back to medical school, there's 1,000 things I would change. But one of the big things I would change is I would have slept way more. So I was that guy that was staying up late, getting up early, because I wasn't a science major. I had literal geniuses in my medical school class at Duke. And so like I felt way behind. And here's the thing, I was probably retaining a fourth of what I was studying. So I could have slept more, studied less, and I would have actually done better. So that's just bad math all the way around. So number 2, and it's worth prioritizing, is sleep. And I'll mention sleep when we come to number 5, okay? All right. Number 3 is exercise, okay? So when I say exercise to a Western audience, you all are thinking marathons, bench presses, yoga, all of those things do count as exercise. But I'm an evolutionary psychologist by training, all right? Your body doesn't know exercise. It knows moving, not moving, okay? So if you don't think of it as exercise to walk your dog, play with your kids, park farther away when you're at the grocery store, take the stairs, all of those things count, okay? So when our ancestors did not exercise, okay, 100,000 years ago on the savannas of Africa, nobody got up in the morning and went, I'm going to run 20 miles for no reason. Nobody did that. They lived very active lives. And I am guilty of this. I sit in an office doing mostly telehealth all day long. Okay, we need to be moving our bodies, even if it's just walk around the building every time you get a coffee break. Really, people always want me to tell them what is the right number for exercise, okay? But let me tell you, you probably heard like 30 minutes 5 times a week or something like that. Let me tell you, the study that came from was hilarious because it actually showed 60 was better than 30 and 90 was better than 60. Well, is 120 better than 90? I don't know. They didn't do the study beyond that. The outcome said 90 is better than 60. And then literally in the study, it basically says, well, we can't tell people that 90 is better. No one's going to do it. Let's dumb it down for people and tell them 30 minutes because they might actually do it. So here's the thing. I don't think your listeners and my patients, I don't think that you're dumb enough that I have to boil it down for you and say, and lie to you about what the outcome is. So is more better? Probably, if you don't hurt yourself or become obsessed with it. All right. So just move your body more. And I used to exercise a lot. Like I was a competitive weightlifter. I used to do triathlons and I still love that. But now I'm in my 40s and my joints don't like it as well as they once did. But I have a 6-year-old who loves to run and jump and play and dance. And I try to be as active as I can with her and then keep my body moving. I actually have, if I were in my office, I'd show you. I actually have a treadmill desk. Nice. So I can walk. I don't do it with patients because you hear the noise, it'd be weird. Yeah. But I really, really like it. So keep your body active, okay? So that's number 3. Number 4 is good diet, okay? So this is my big specialty. I could bore you into a coma right, with as much information about this as I could, but I won't, okay? There's a lot of good resources. The best resource out there, there's a wonderful website called nutritionfacts.org, okay? Nutritionfacts.org is run by a physician named Michael Greger. He is the most type A, like hilarious, physician ever. He has a great YouTube channel. His website is amazing. He's very quirky. It's hilarious. Like he's kind of funny. His videos are all short. It's a great resource. And then, but it's pretty advanced. And you can get. He has a couple of books that are amazing. One is called How Not to Die, and the follow-up is How Not to Diet.
I've read that.
Now, so yeah, they're like the size of the Encyclopedia Britannica. So honestly, for beginners, I would recommend The Starch Solution by John McDougall.
Okay.
The Starch Solution by John McDougall. But here's the short version of the story. Again, I could bore you into a coma, but I won't. The short version of the story is that all of the named diets, keto, paleo, Atkins, Mediterranean, South Beach, nonsense. No science behind any of it. Anybody who tells you, oh, there's good studies about, no, they're lying to you. They're absolutely not. Even the plant-based ones that are closer, vegan, vegetarianism, they're closer. But you can eat a lot of garbage and still be a good vegan. So Twizzlers and Oreos are vegan, just so you know. And I was a vegan. I was a vegan for years, okay? And technically, I still eat a plant-based diet, but I try not to use the V word anymore because the actual thing, if you look at the data, we really haven't had large access to processed food until after World War II. So if you look at what's happened since World War II, obesity, heart disease, diabetes, stroke, cancer, all of them on the rise, okay? So before that, not many people had access to heavily processed food except for kings, queens, emperors, popes, and so forth. What did those people die of? Heart disease, diabetes, obesity, cancer, and strokes, and so forth, right? Okay, so I tell people that diet is not a zero-sum game. And what I mean by that is it's not like If you can't do it perfectly, you shouldn't do it at all. People get this vision like, if I can't do it perfectly and just eat microgreens that are organic, watered by the tears of angels, I'm just going to eat double fist cheeseburgers all day. It doesn't have to be that way, okay? So, and this is where Dr. Greger is great. He'll talk about how they did studies where there are people that they gave them like big greasy steaks, and they had them eat, half of them just got the steak and half of them got a cup of blueberries ahead of time. And the badness was so much less mitigated by the berries because the antioxidants in the berries are so powerful. So it doesn't have to be, you want to go for less processed food, not zero processed food. My last shout out will be to the man that really taught me how to do therapy and really got me into this, is a man named Doug Lisle. Okay, so Doug Lisle, you can find him online, esteemdynamics.com or org, I'm not sure. He and his partner Jen Hawk do therapy kind of stuff, but they also are big into this plant-based nutrition. And Doug and Jen are much more middle of the road. So they're not like the way out there, like eat nothing with a shadow kind of vegans, but they also aren't going to lie to you and say, oh yeah, eat all the steak you want, it's fine. So, but now, why does it affect our mental health? So we can all understand why it affects our physical health, right? If you eat the food that your species was evolved to eat, we can understand why physically we'd be doing well, right? So 0 animals in nature are obese. 0, not 1, 0. Okay. In fact, there's only 3 animals that are obese: dogs, cats, and humans. Where do they all live? Right? Together, right? In the same thing. Now, if you take an animal and you put it in the zoo and you feed it food not natural to it, it gets fat, it gets sick, it dies of diabetes, heart disease, cancer, stroke, and so forth. It's science. It works, doesn't it? Okay. So all of this to say that that again, we want to do less processing, but it affects our mental health because yes, our physical health is better, and therefore we feel better mentally. But all the neurotransmitters in our brain that the medicines that I prescribe work on, serotonin, norepinephrine, dopamine, they come from somewhere. They're in our brain, right? How'd they get there? It's not magic. They came from the food that we eat. Our body makes them. So if you feed your body what it was evolved to eat, everything works better. Okay. And then number 5, last but not least, my absolute favorite is meditation. Okay. So some kind of a meditative process. Now, I teach what's called mindfulness. I became certified. I teach mindfulness. My wife is from this weird little town in Southeast Iowa where they do transcendental meditation. That is fine. They will tell you that their stuff is better. They paid for their studies. It's right there on the study. The TM movement paid for it, but I'm not saying it's bad. Okay. In fact, when Dean Ornish did his studies, he's one of the big plant-based guys. When he did his studies in the 90s, they had all kinds of other meditative things like contemplative prayer, walking in the woods, and do not think you have to be a Buddhist or a Hindu to meditate. Okay. Every major religion, the Sufis in Islam, the mystics in Christianity, like Francis of Assisi, Ignatius of Loyola, Saint Teresa of Avila, Saint John of the Cross, right? So all the major religions have this meditative component. All right. And meditation is kind of what I came to last. I totally wish I would have known about it 20 years ago. Right? Something else I would have done a lot differently in medical school is I would have meditated every day. And I would have done way better if I had. Okay. So why is meditation so powerful? There's 1,000 reasons, but here's the big one. I'm going to tie it back into 2 of the previous things. Okay. There's 2 reasons. I said 1 reason, 2 reasons. Number 1 is, if you think about it, meditation is therapy with yourself. So remember I said therapy was the king, the queen, the undisputed heavyweight champion, right? So think about this for a second. When you talk to a therapist, what do? You put your thoughts out of your head into the room, and then you and the therapist talk about it, and you parse through it, and you think, okay, I think out loud. What should we do? What about this? What about that? When you're meditating, you do that with yourself, okay? And so it's like doing therapy with yourself. And the second thing, the second big reason about meditation is people's sleep tends to improve dramatically. And remember, sleep was number 2, all right? So I always tell people, except for having children, I'm not overstating this, except for having children, nothing in my life has been more powerful than getting serious about my meditation. And I don't do it nearly as much as I wish that I did. Someday, I'm going to dedicate much more time. But even though my own life improved so much by meditating, my sleep also got a lot better. So I have to say, I'm a scientist, I can't for sure say it wasn't the sleep playing a bigger role, but both of them are good. Okay. So
can I ask a question regarding meditation? I can't stop myself. So I read a book about it. I have this mind that doesn't like to stop.
Yeah.
And and when you talk about sleep, I mean, I can take everything out of my room. It's been happening since I was a little girl, going to bed in a dark room with one book to read or whatever. It just is really, really hard. And so, and I know a lot of people say this about meditation. So I love to jog.
Okay.
I feel like I get into a meditative state when I'm jogging and I
Right.
don't listen to anything. Does that count? And
Absolutely.
and
Yeah.
also, like sometimes if I listen to something like to get my mind, you know how you can find meditations online, and so when you say meditation, it's really hard, and I keep working on it for me to quiet my mind and to not get mad at myself in the
No,
middle of it. So,
that was
any advice?
that was a beautiful segue. I was actually just going to talk about that. Perfect.
Yay!
So one of the things I would say, just so I don't lose it, because I'm going to get into my little thing here, is that when you talk about running or something like that and getting into that, you'll hear people talk about flow. Okay, so getting into a flow state. And there was a really famous psychologist named Csikszentmihalyi who talked a lot about getting into these flow states. And the sports experts, talk about people like Jordan, would get into these moments. This is why
Yes.
people like rock climbing and these really intense sports, because you have to be solely focused. All right. So absolutely. That's why I said like contemplative prayer, walking in the woods. Ornish talked about walking in the woods with no earphones in.
Yeah.
So things like that can be very meditative. I have patients who like to do long motorcycle rides with no radio or anything, and it's very, very meditative. Okay. So, but the one thing I will say is I often get people who say to me, I can't meditate. My mind is too noisy. That's the point.
I know.
So there's a lot of misconceptions about meditation. We could do a whole other one about just meditation. But here's the big thing. The first thing is people will go, I tried it. It just didn't work for me. Again, that's like saying I sat down at a piano and I wasn't ready for Carnegie Hall in 5 minutes, and therefore I can't play the piano. A, it takes practice. B, the biggest misconception about meditation is I'm going to clear my mind. No, you're not. No, you're not. The Dalai Lama has said he can't clear his mind. And here's the thing. One of my teachers would always say, let's imagine you could clear your mind. What earthly good would that do?
Right.
We could give you anesthesia and clear your mind and you wouldn't come out any wiser.
Right.
So here, this is why it's so important and why it's so powerful. The point is not to clear your mind. The point is to accept your mind for how it is. So when you get into meditation, I'm going to recommend a couple of apps here in a minute that I also have no financial interest in, by the way. But when you sit to meditate, instantly your mind is going to wander. So whether you sit and you're trying to watch your breath, you're trying to look at a visual aid, you're listening to a sound, you're doing a mantra like in transcendental meditation or Tibetan Buddhism, instantly your mind is going to wander and you don't even notice it. But then at some point you notice my mind has wandered and you could come back to your meditation object, back to your breath, back to your mantra. Instantly it's going to wander again. Back you go, back you go. What are you doing? You're doing bicep curls with your mind. Okay. And so you do get better at it, but the point is not, I'm going to clear my mind. Oh, I'm going to clear it. Oh, I can't clear it. Oh my God, I can't clear it. You're never going to clear it.
Right.
So when we get anxious, we have panic attacks, we're worried about the future because, oh my God, I'm getting divorced and what's going to happen to my children or to my house or to, this person was supposed to be the love of my life. I made a vow before God and all this stuff, but so when those thoughts come, we don't try to push them away. The famous meditation master Thich Nhat Hanh used to say, we just lost him recently. He used to say, you have to think of your thoughts like a crying baby. If you scream at a crying baby and go, frickin' quit it, it's not going to do anything. You hold it and then it stops crying and you put it aside. So what happens is the metaphor that's always used in meditation is that of waves in the ocean. Okay. So a wave comes from where? It comes from nowhere. It just comes from the water. And where does it go? When it goes away, it goes back to the water. Our thoughts are exactly the same. So we always tend to use negative examples here, but let me use a positive one, okay? Something you wish you could hold on to forever. The best meal you ever had, the most in love you ever felt, like the greatest movie or song that you could possibly imagine. You wish you could keep that rapture forever and ever, but you can't. It goes up, it goes down, okay? And so do the bad feelings, anxiety, fear, depression, up and down it goes. And so what you do is you eventually learn, and it's hard. I am not great at it, and I'm sure once you get a lot of hours under your belt, you get much, much better. In fact, the medical studies using fMRI show this to be true, but I haven't gotten there yet. But you get to the point where you watch the feelings come and it's like, oops, there's that anxiety again. Right. And I'm just going to watch it. I'm not going to judge it. You're not going to die. So even your body goes, oh my God, I'm going to die. You're not going to die. You're in a safe setting. And eventually it extinguishes. That's the psychological word, all right? Just like Pavlov, it extinguishes. And so, and over time, you can actually extinguish those feelings. So not easy at all, but definitely worth your time. So I want to recommend 2 apps, because a lot of times people do find guided meditations to be easier in the beginning, to have somebody lead you. Now, when I teach people, and this is how we teach children, but I'm in my 40s and I still like this, we begin with a walking meditation. Okay. So walking meditation is easier. I'm doing air quotes again for those of you that are just listening. It's easier because you have something to do. All right. And so when I have patients, I send them an email that has a couple of YouTube videos that are teachers of mine teaching meditation. One of them is a walking meditation. All right. And so that's a great way to start, especially if you feel like I just can't sit still. Great. Do walking meditation. It's so much easier to do it in the beginning. But then also, there are 2 apps. One is totally free. It's called Insight Timer. Okay. And I think you can only get it on Apple products, but I only have Apple products. But I recently tried to look for it on a Kindle and I didn't find it. So I think it's only an Apple product. But I believe it's put out by the Insight Meditation Society in Barre, Massachusetts. It's free. They do have a paid version. I can't figure out what you get for the paid version because it's over 100,000 free meditations. And so everyone I know that uses it uses the free version.
Okay.
And they've got really good meditations for sleep, and you can do your own timer thing. It's fantastic. Everybody I know who teaches uses Insight Timer.
Okay.
The second one is Sam Harris's app, which is called Waking Up. And so Waking Up does cost money, although if it's too much for you, you can request either a partial or a full scholarship. And according to Sam on his podcast, he says he never denies anybody. Now, I don't know if that's true, but I've been listening to Sam for years and I believe him. So, but the nice thing about Waking Up is that I subscribed to it maybe a month ago because I just love Sam Harris's work. But I worked my way through Sam's introductory course, and he actually teaches you, and he has one for every day for the first, I think it's 28 days. So that does cost a little bit of money unless you get a scholarship, but you kind of can work your way through that. That way, at least you can have some kind of guidance for it. Now, there's also Calm, 10% Happier, Headspace. I have nothing bad to say about those. I just have never used them.
Okay.
So I don't want to say, oh yeah, they're great, because I don't know, but I mean, I'm sure they're great. And if you have one that works for you, there's no reason for you to switch, although you could get the free one, because why not?
Right.
And so just to wrap up my 5 things, and I'll let you ask any questions. So I always tell people at the end, here is the beauty of the 5 things, okay? Number 1, there's no side effects, all right? So any medicine from a Tylenol to a Vicodin has the potential for a side effect. Medicines are blunt instruments. You wish your Tylenol would just go to your head, but it goes to your big toe as well.
Right.
Okay? So they're not precise. So the good thing about the 5 things is no side effects. And then number 2, when I make a medicine change, I only ever make one at a time. I have to tell you, I will not be popular for saying this. I am horrified when I cover for a colleague and they've made 2 or 3 med changes at once. I still don't think it's very scientific. If somebody comes back and they're doing good or bad, you don't know what it is. You have no idea. To me, it's bad science. So I always, much to the frustration of some of my patients, I only do one change at a time. Yeah. When it comes to lifestyle stuff, you can change everything you want. So if the next time I see that patient, he or she goes, guess what? I'm in therapy. I'm sleeping better. I'm exercising. I'm meditating. I'm eating more plants. Less processed food, whole fruits, whole vegetables, whole grains. Potatoes are great for you. Anybody who says carbs are bad is a dummy. Stop listening to that person. All right. Saying carbs are bad is literally saying a sweet potato is the same as high fructose corn syrup. Right. That is literally a nonsensical statement. Anyway, we can make all the changes we want. So I'm just telling you, and it's evolved over the years as I've gotten more resources and done more research, but I'm telling you that when it comes to self-care, even in my own life, if something is not going the way I want it to go, the first thing I do is I think about my 5 things. What am I not doing? Oh, you know what? I haven't been sleeping as well. Or, you know what? I haven't been exercising as much. I mean, it's not magic. And some people definitely need the medicine. I'm not saying don't do that. but we were talking about taking care of yourself. And in the wake of something like a divorce, or the process of divorce, when I went through it, was hurry up and wait. I mean, it was incredibly stressful.
Yeah.
So then like you want to have, and no medicines are quick. Even
Yeah.
Xanax, which usually comes in quickly. But if you can focus on your breath, I will say, I listened to one of your previous people who said, I recommend people do this breathing thing where they do 5 seconds in, hold for 5 seconds, and 5 seconds out. I have to respectfully disagree, because if you look at the studies, this is the secret to breathing. Every time someone says, oh, my therapist taught me breathing, I say, show me your breathing. They almost always are doing it backwards, and they do it like this. All right. So that is what pregnant people and boxers do. All right. So here is the secret. I literally took a 10-week class with the man who holds the world record in breath holding. All right. And it was billed to me as, this is going to help your singing. Okay. He held his breath underwater for over half an hour.
Oh my God.
Okay? I quickly figured out what he was teaching was an anxiety technique. Because if you're going to go underwater for half an hour, you better be able to control your anxiety. Here is the secret. You breathe out longer than you breathe in. I swear to God, it's that simple. Okay. If you breathe in longer than out, and even that equal in and out, you're going to activate what's called your sympathetic nervous system. That's fight or flight. Okay. But if you breathe out longer than in, you're going to activate what's called parasympathetic. That's rest and digest. Okay. So as a singer, I tend to think in four. So when I do it, whether I'm going to give a speech, whether I was in my powerlifting days and I had to go get up on the platform, so I think in for 4, out for 8 or 12 or something like that. But you could literally do in for 2, out for 20. Whatever you want is fine. But that's something you can do in the moment. You can work on therapeutic techniques, get up and move around if it's exercise. How's my diet? Can I do my meditation stuff? You can do that, and it can give you, if not instant relief, much faster than most of the medicines I give. It takes a month.
Right.
We got to go up in dose maybe. So anyway, that's those are my advice pieces. We're at 52 minutes.
I know.
I told you. But anyway, that's my 5 things. So there you go. That's why you asked me to be on your show.
I know. And I love that. And it's very meaningful to me because those 5 things are kind of new to me and important. And I want to say too that I have struggled with anxiety all my life. And probably a couple of years ago, I went on, right, when COVID hit, I did go on anxiety medication with the idea that I'm going to do everything else too. Then I got my life coach and I started changing all these things. So I can't really say what actually was the ticket, but I think I was on that anxiety medication for 9 months and have gone off of it and am a different person. It's kind of amazing.
Medications are tools, and so people, they're useful. If you have a screwdriver and you're trying to hammer in a nail, there's no reason to not use a hammer.
Right.
But at the same time, just like my metaphor of the broken arm, what the goal should be. And some people need medicine for the rest of their lives, and it's okay. Okay, it's okay
Right.
if that's you. But for the vast majority of people, if we can work in all or most of the 5 things, I can get the doses down really low, and usually I can get people off of stuff after a while. And sometimes we go back on because life happens, but it's not some kind of a failure if you have to be on it. But I just think people need to know the other options, because again, remember, the way that 99% of your doctors, that's family medicine, pediatrics, OB, and psychiatry, which are the main prescribers of psychotropic medicine, the way that they're taught is symptom drug. That's what we're taught. I was taught that too. And in Iowa, there's this big thing where some therapists can prescribe. I know I sound like sour grapes, but I really don't agree with that, because they haven't taken the physiology courses. And as far as I know, they're just a symptom drug for them too.
Right.
So, I'm never going to get this to be as known as I wish, but I'm going to,
You never know.
spend my whole career talking about this as much as I can. And just, I've seen it really change people's lives. And I joke with people, I'm trying to put myself out of business. And you know what? If I could get everybody to do all this stuff and I went out of business, I love school. I'll go back and get a PhD and go teach philosophy or something. Like, it'll be fine, So anyway.
I love when people are so into adding value to others' lives. And I hear you, because there are people, I have autoimmune things, and now the way that I eat, I have no issues.
Yeah.
Now, yeah, I had to stop having dairy, processed foods, gluten. I changed my life, and I would never go back, because on the 4th of July, when I let myself have a little bit, I had shooting pains and achy
Yeah.
joints. I'm like, I am not. And you just wish that everybody could just try it, because it can be so life changing. So, on so many levels, I am just geeking out about all this stuff, and I love it.
And so one of the things I'm taking right from Doug Lyle, the guy that I mentioned, but he won't care, is that any of these things, you don't have to. Actually, I didn't think about this. Is kind of a joke now that I think about it. You don't have to get married to all those things. All right. What one of the things that Doug always says, and I absolutely agree with him, is you're just running an experiment. All
Yep.
right. And so if somebody asks you why are you eating that way, you go, I'm just running an experiment. And so take 2 weeks. Take a month, take 2 weeks, make it longer than a day. It takes a little longer than a day, but prepare, plan ahead of time. But if it's meditation, if it's whatever else, to be like, I'm just doing this experiment, and
Right.
you tell yourself that, because then you didn't fail. You ran an experiment. Who cares?
Right.
But people get into this thing like, I'm never eating pizza and ice cream ever again,
Right.
which is ridiculous. Of course,
Right.
in 99% of people, you're at some point in your life, and then you set yourself up for a failure. This just not going to happen. And so you put that on yourself, and it takes time to learn that. And I get it, but like, we're just running experiments here. We're just trying things out. This is what I do in the office every day. This is what I work on people, and I see them back. How's it going? This didn't go well. Great. What else can we do?
Right.
There's and I see myself a lot as cheerleader, as much as doctor. And because I have this background in the chaplaincy, which I was basically a therapist in the military, the chaplains are used as therapists. I've done all this therapy, all this counseling, premarital, divorce type stuff as well. I mean, this is why I developed this whole body approach, and it's absolutely worth anyone's time to look into any or all of those things.
I am in complete agreement with you. And I don't know if you can just briefly talk a little bit about divorce, and how you, I mean, is it going to be too, do I need to have you back? I think we
Well,
already have 2
yeah.
episodes right now.
I was actually going to suggest, since we're coming up on an hour, that if
Yeah.
it's okay with you, it might make more sense to have me back as a repeat guest, and we'll talk about, because I mean, my little post-it that I have here, my classy post-it that I got for you, I actually have several points that I was going to talk about that I imagine we could fill an extra 25 or 30 minutes with. So I mean, it's up to you. You're the host, but it makes sense to me to.
I would
Uh,
I would love to have you back, because there are some things I want to dig into a little bit more too. Like,
right.
what do you think about fasting? And
Yeah. Oh, we could
so
talk about that forever. Yeah.
yeah. So, okay. So now that we're winding down this episode of the podcast, I have my saddle up segment, where I ask my guests to get, and I know you've given so many tips, but if there was just one small, easy thing that my listeners could do right away to help them move forward to a better life, what would that be?
What I really want is for people to be good to themselves and to be true to themselves. And so any of the 5 things would qualify for that. But honestly, I truly believe that meditation is the most underutilized tool. And if I could change anything about the vast majority of my patients' lives and the people I encounter, I really would encourage them to. I know it's tough, but to work on it, and to understand it's a process. But that tool, the ability to, whether it's relax or feel positive feelings about people using what's called metta meditation or loving kindness, or whether it be focus for those of us that have ADHD and so forth, the fact that you have this inherent circuitry in your brain that allows you to not really control your emotions, but to sort of accept where things are, and not be bothered by them. It's just absolutely, there's not enough words that I can say for how powerful and incredible that is.
All right, that is a great piece of advice. And before we go, there is something that I know that's dear to your heart that you want to talk about, the Rent project, and I'm going to let you talk about that briefly here, and then I want to let my listeners know that we will have this information in the show notes. We'll have how they can, I don't know, you have a website. I'll have that all in there so that they can connect with you. But do you want to talk a little bit about your theater project that you're involved in?
Yes, I will attempt to be briefer with this, but I could easily talk about this forever. So I would encourage people to look at our website, which is www.iowarentproject.com, and you can get a lot of information there. So as I said, theater used to be my job. It's very much my passion. I do a lot of work with people in the LGBTQ community, whether it be teens, even younger than that, young adults of all ages. And when I was in high school, the musical Rent came out, and it was the first show I saw on Broadway with the original cast. I got to meet a bunch of them. It was so awesome. It changed my life, made me want to go into theater. And I've wanted to do a production of Rent for a lot of years, but not just another community theater production of Rent and oh great, they're singing the songs, but to use it for a bigger purpose. So when this finally got off the ground, we're partnering with the Iowa City Community Theater. We're actually doing it as a big charity project to raise money for these three amazing LGBTQ and HIV/AIDS nonprofits that are local, and they have, but they really extend to the whole Midwest with what they're doing. They have mental health population services that they do. We really want to do this awesome show. I'm producing the show, so I'm not directing it. I'm actually hoping to get a role in the cast, actually. And so, but I want to get them as much money as possible, get them as much publicity as possible. I've hired consummate professionals, the directors, the set designer, the light designer, the choreographer. It's really going to be a special show. I'm really excited. So the performances are in December. If anybody local is listening, we're actually going to have auditions. We announced them yesterday. Auditions will be in August. So we have a Facebook page, Iowa Rent Project, and then the website. So there's so much more I could say, but that's the brief part. And thank you for letting me pitch it.
Of course. I'm so grateful for having you. I mean, Dr. Adam Woods, your 5 steps, your story has meant the world for me to be able to share this. And it's going to be 2 episodes, and we're going to have you come back. So I appreciate you. Thank you so much for adding value to this world and for being with us today.
Thank you so much. What an honor to be on the show.